Hi, Dr. Bo here again. I'd like to try to explain concepts, which should probably call these concepts. When you're doing your roller, I saw Dr. Mondragon last night doing her roller, and I like her work so much. And as you do the roller, she was warning people not to go down, too much into the bottom part. As you roll this up and down your spine, you can see what it's doing. It's moving all these vertebrae very nicely, which is what you want right in through here. You want to keep this diaphragm area, this core, they call it the core. And one of my pet peeves is not to keep this core tight. And if you exercise the bottom of the back, the L4, L5, which is where everybody comes into my office with this worn out. If you're over 60, this is already worn out, this bottom L4, L5, S1, L4, L5, S1. And these discs get worn out. Now, the reason why they get worn out is because they do too much work. So if the core is tight, it's not going to help you move. So you're going to end up sending the work of whatever you're doing, moving through space, picking up laundry off the floor, whatever you're doing, you're going to have your low back doing it. So make sure you're breathing, because the diaphragm sits right here. Don't be locking this up, because the more you keep this loose, and that's what I work on most of my patients, I work right here. You won't see me ever already down in the lumbar spine because I'm making it looser and then making it wiggle more and making it wear out more. So I know I'm getting all excited, sorry. But if you do the roller, I wanted to show this concept of when you're doing any kind of roller. If you put it down here like this, and Dr. Mondragon was talking about this last night, I saw a live presentation she was doing. Can you see that if you have the roller here and then your booty, somebody has to bend over this. And if your booty has to get down to the ground, can you see it's going to go loosest part first? The tight area is going to become more resistive to bending over the roller. So if you're here like this and you don't keep something under your bottom to help keep this from going all the way, you'll end up overbending. Do you see? At the L5S1 area, because the roller is putting a force in from the back, and then it's asking somebody to do this bend, and it will be the loosest part of the spine making the bend. The disc was crooked, so I had to straighten it out. So my point is, be careful when you come down and you're doing your diaphragm work, your core loosening work, not your core tightening work. And then somebody's going to be bending over this. Don't allow it to overbend at the L5S1 and torture these discs down here. So keep this a little bit supported. You don't want it to go past 30 degrees or so in this curvature. What I'm going to eventually get is a protractor, and you'll see these angles and how you don't want to achieve more than 30 degree of a backward bend on any device. You'll end up cracking the vertebrae in the back here and getting spondylolisthesis, which happens when you bend over too much on these things. So be careful. Make sure you're keeping your bottom supported as you use the roller, and you want to loosen this core like that. You want to roll this up and down your back like Dr. Mondragon was doing last night in her live presentation. But you want to do that to loosen this area, and don't ever usually take this down to L5. You don't want to stimulate more looseness in the lower lumbar area. Keep it up in the diaphragm area. You should have trouble like breathing while up here. You should notice it's pushing on your breathing muscles. So you should notice some distress in breathing because you're working on this part of the spine, which is usually over tight and looks brand new, by the way, on the x-rays. And that's why the bottom looks worn out. There's a misdistribution of workloads. And that's what this is about. It's not about popping the vertebrae or cracking the vertebrae. It's about getting the workloads as you get older to the better parts of your spine and leave these looser parts of the spine. That's why you wear a back brace. Why do you wear a back brace when you're going to go out in the garden and do some heavy work, whatever? Put a back brace on to protect this part of your spine. Let this part of the spine do your work. Well, those are some ideas, some concepts. Like and subscribe. Thank you very much.